As promised and in line with our commitment to eliminate all forms of fraud, and after an extensive review and audit of flagged suspicious claims, we have found several injurious activities that facilities have been engaging in to fraud the Social Health Authority in blatant disregard of the provisions of the Social Health Insurance Act of 2023 and also their contractual obligation which they have signed with SHA. These activities undermine the public trust in the country's health system and threatens the feasibility and the sustainability of the Social Health Authority. Some of these activities we have flagged for the system, the forensic auditors have flagged include: number one, app coding, deliberately submitting a claim for more expensive procedure than the one which was actually performed. This contravenes clause 16, subclause 1.1 of the SHA contract and section 45, subsection 8 of the Social Health Insurance Act 2023. For example, a facility in Nairobi lodged a claim for a more expensive TURBT procedure which was worth 201,600 shillings, 201,600, after having only performed an open prostatectomy worth 89,600. In essence, claiming more than 112,000 from what was correctly due to that facility. These are direct depletion of the collective fund that is meant to serve all Kenyans. When fraudulent claims are paid, the pool of resources available for all hardworking and responsible Kenyans is reduced, ultimately jeopardizing the sustainability of our entire system and scheme, and leaving the most vulnerable section of our population exposed when they need the care. Number two, some of the activity that has been flagged off are the falsification of records which are submitted to the Social Health Authority through the Digital Health Agency Superhighway, submitting altered or false information. This contravenes clause 16, subclause 1.8 of the contract, as well as regulation 48, subsection 5, and regulation 34, subsection 2F of the Social Health Insurance Act of 2023. A facility in Bungoma, for example, submitted falsified medical records in support of a claims for a patient who was concurrently admitted in another facility. This is illegal and is punishable under the law. It also leads to exaggeration of claims which adversely impacts on the financial sustainability of the Social Health Authority. The third issue that we have flagged out, or the system has flagged out, both at Social Health Authority and DHA, is the tendency by certain facilities, both government, faith-based, and private, of conversion of outpatients into inpatient. Some hospitals in Nairobi and Homa Bay have been billing for inpatients admission that the patients have since denied ever receiving. And our team have spoken to those patients, and the patients have recorded statements denying that they were inpatients and only they were outpatients. The hospitals have also been converting simple outpatient visits to very comprehensive inpatient care so as to claim more money from SHA. This is an illegality and outright theft contrary to Regulation 34, subsection 2B of the Social Health Insurance Act of 2023. It also undermines the prudent use of public resources. It further exposes SHA members, as SHA may not be able to pay for its members when its sustainability has been jeopardized through illegal activity. And this is what they have been doing under the defunct NHIF.